I come to the floor today on behalf of over 10,000 constituents from my home state of Washington who have sent me letters and emails over the past 6 months to tell me their stories and their struggles with our healthcare system. And I come to the floor today on behalf of the thousands more who don't have the time or who don't have the resources to write to me and ask for help, but who are struggling as well. Mr. President, I come to the floor today on behalf of small business owners, parents, senior citizens, and people with pre-existing conditions, people with insurance whose premiums are skyrocketing, and people without insurance who spend their nights praying they don't have an accident or fall ill. Mr. President, these people are all worried about keeping their jobs or making a mortgage payment, and for whom the cost of getting sick today or being dropped from their health care plan or opening their mail to see another premium increase is just too much to bear. And Mr. President, those are the people who deserve a real debate and a real plan, not distortions or silly distractions, like conversations about how many pages are in this health care bill. What is more important than the number of pages in this health care bill is the help within those pages for businesses and families across this country. Now, Mr. President, I have watched day after day after day after day as our colleagues on the other side of the aisle have come down to this floor. They've made outrageous claims. They've handed out reams of paper and stacked copies of the Senate bill on top of copies of the House bill to try and turn a serious debate into a sideshow. But if my colleagues on the other side want to focus on pages, fine. Let's focus on pages. Mr. President, beside me is a photo of a woman named Doreen Kelsey. And in front of Doreen is a stack of papers. Those are hundreds upon hundreds of pages of forms and rejection letters and appeals and denials from her insurance company. These are pages that have taken hours and hours to fill out and that have stood between Doreen's husband and the care that he desperately needed. You know, I met Doreen at a roundtable I hosted in August in Spokane, Washington, in my state. Doreen told me that she's self-employed and isn't able to purchase her own health insurance because she has a pre-existing condition. Now, luckily, she and her family have health insurance coverage through her husband, Tony's employer. Now, Doreen told me that she and Tony thought their family had good insurance coverage. But when he asked for a colonoscopy, they soon discovered the lengths to which insurance companies will go to deny, to delay, and dispute the care that families like Kelsey's assume were included in their coverage. Their insurance carrier told them that before they would pay for this preventative care, it would have to be approved by a primary care physician. After being delayed for more than a month because of that requirement, and this little stack of papers here, the colonoscopy ultimately confirmed their fears, and he was diagnosed with stage 4 colon cancer. Now, that diagnosis in hand, the Kelseys were determined to beat this terrible disease together. But rather than focusing on fighting cancer, they were forced to fight their insurance company. Now, Doreen told me that although they had faithfully paid their premiums throughout their entire working lives, now that Tony desperately needed life-saving treatment, he was in a constant struggle of paperwork with his insurance company to pay for even return care. Now, they weren't asking for anything new. They weren't asking for anything experimental. They were just asking for the kind of care that a lifetime of paid premiums should entitle them to. The Kelseys assumed what most Americans do when they're paying for good health insurance. They assume that while their insurance may be expensive, it will be there for them when they need it. Well, Mr. President, Doreen and her family, like many other American families and businesses, have come to find that out, that in our current health care insurance system, stability is sometimes nothing more than an illusion. With each procedure and each battle, the Kelseys faced a new fight. More paperwork, stacked on more paperwork, another appeal and another appeal. And at one point, Doreen told me that she had to appeal all the way to the state insurance regulator just to get a corrected explanation of benefits, paperwork, form from her insurance company. And she told me they had to borrow thousands of dollars to pay doctors while their claims were tied up in what seemed like an endless appeal process. Paperwork, Mr. President. The Kelseys' insurance now costs more than their mortgage, and they are constantly worried that Tony's employer could drop that coverage. Now, thankfully, she told me that Tony is successfully and working hard to battle his cancer. And Doreen, in the meantime, has successfully been battling her insurance company. But this isn't how our system should work, Mr. President. And when we pass the bill that is in front of the Senate we are debating on, it won't be. So let me tell all of you and the Kelseys how our bill will help them. First of all, our bill ends that insurance company discrimination for pre-existing conditions. So in the first place, Doreen can then be able to purchase insurance on her own and not have to rely on her husband's employer. Doreen would also have access to a number of different plans through an exchange that we're setting up, where insurance companies, for the first time, would have to compete for her business. Our plan would inject competition into the insurance market, and that, Mr. President, we know will lower costs and give families like Doreen's more choices. Our plan also makes it illegal for insurance companies to drop people when they get sick. So Doreen and Tony wouldn't have to worry about losing their coverage at the moment that they needed it the most. And since we know that preventive care is critical to saving lives and saving money on health care costs long term, our bill ensures free preventive services under all insurance plans. Our plan invests in prevention and in public health to encourage innovations in health care that prevent illness and disease before they require more costly treatment. It would have allowed Tony to get a colonoscopy when he first needed it, so he could get his treatment started sooner. Mr. President, we also know that families deserve the security and stability of knowing that if they or their loved one do get sick, they will not be forced into bankruptcy to pay for the costs. Our bill restricts the arbitrary limits that insurance companies currently place on the amount of coverage that families receive. It caps the total amount that insurance companies can make people pay out of pocket on copays and deductibles. And it eliminates the lifetime limits insurance companies can impose on coverage. Now, in addition to putting in place those important consumer protections that would help people like Doreen and Tony, it will give families the stability and security they deserve and lower the cost of care, so Americans like Tony and Doreen won't have coverage that costs as much or more than their mortgage. And we do that by putting in place premium rate reviews to track increases and crack down on excessive insurance company overhead costs. When our bill passes, and Mr. President, I'm confident will, despite the delay and the delay and the delay that we are seeing on the other side of the aisle, insurance companies will no longer be able to hike up Doreen's premiums to pay for a bureaucracy that they will then put to work battling her claims. And we provide sliding scale premium tax credits for families who still can't afford coverage, which would help in my home state of Washington about 450,000 people get the coverage that they need. Mr. President, the bill before us today, which my colleagues, some of them have sitting on their desks and bring out here on a daily basis to show us the pages, will help families like Kelsey. That's what is within those pages that we keep seeing thrown at us. So I think, Mr. President, rather than talking about the number of pages in the bill, I hope our colleagues on the other side actually talk about what's in it. Because right now, instead of debating the merits of bringing down costs, or protecting families from losing the coverage when they get sick, our colleagues are actually spending time complaining this bill has too many pages. Mr. President, I ask you and our colleagues on the other side to take a look at this photo of Doreen sitting next to hundreds and hundreds of pages of correspondence and appeals and fights with her insurance companies. These are the pages we ought to be talking about. These are the pages that impact people's lives. And the Kelseys are the people we ought to be talking about. So when my colleagues come on down here and complain about the number of pages in our health reform bill, those pages that will help our families and businesses lower costs, I want them to think about the number of pages right here in front of Doreen. These are pages that have caused the Kelseys unimaginable heartache. And these are the pages that have come between them and the health care that they paid for. These are the numbers we ought to be focusing on. The 14,000 people who are losing coverage every day are the numbers we ought to be focusing on. The 51 million people who have no insurance, those are the numbers we ought to be focusing on, not the number of pages in the bill. Mr. President, we've got to end the politics and the delay and the partisanship. We need to end this obstruction, because that's what the Kelseys faced every day, was delay and obstruction. And they're facing it again here on the floor of the United States Senate. It's time for us to come together on this important bill and bring our businesses and our families the insurance reform they've been asking for.